So again, we do welcome questions and discussions in this session, so feel free to raise your hand or send questions in the chat. We'll do our best to monitor them. And who we have on the line, we have Vince Strain, and he's the Supervisor of Prevention Services with WorkSafeBC. And I know it is just crazy, unbelievable times right now. So Vince, we really appreciate your time and being able to walk everyone through these new procedures and the guidelines here. So what I will do is I'm going to share my screen, and then Vince, I'll let you go ahead and take it over.
Okay, great. Thank you very much for having me here today. Yes, this is it's a very busy time for everyone. A very challenging time for many businesses around the province, and our role in this, as in regular times, non-COVID pandemic times, is helping workplaces maintain a safe and healthy workplace for their workers. This situation is a little different now because we've been asked by the government and the public health office to assist in developing resources to assist workplaces in the province at getting back to work now that we're hopefully seeing a decline. We are seeing a decline, and hopefully it's a sustainable decline in the number of infections, and it's looking quite promising. So as part of that approach, WorkSafe has developed some resources, and we continue to do that, and we're going to be reaching out to as many businesses, as many workplaces as we possibly can to assist with that and make sure that this is moving in the right direction. So could I have the next slide, please, Deanna? So the agenda today, you see that it's understanding COVID-19. I'm gonna speak to that a bit. I'm gonna talk about developing your businesses or your workplace's COVID-19 safety plan. Part of that safety plan is controlling the risk of COVID-19 exposure in the workplace. There's some specific industry information that has been developed, and that will continue to evolve. We are developing more resources as we move through this process. So right now, pretty much every workplace that is identified in the government's phase 2 restarting the economy plan, we have some specific industry information for those workplaces. I'm going to provide some information on how to receive additional support from WorkSafeBC, where to find other resources, and hopefully if there's time at the end, we'll have some adequate time for questions and answers. So I'll be walking you through some of these topics, expectations on how to develop your COVID-19 safety plan, some strategies. We'll go through the steps fairly quickly, but this presentation and a more detailed version of this presentation will be provided to everyone. And as Deanna said, this is going to be recorded and shared for anyone who was not able to join this Zoom meeting today. Next slide, please. And we'll just, that's just a title slide, so let's just skip to the next one. COVID-19 symptoms and transmission. I'm going to speak to this because it is fairly important, but I'm going to go through it fairly quickly. I think there's a lot of information here that's been published in numerous other venues and sources, but just in general, coronaviruses, which the COVID-19 disease is caused by one of these coronaviruses. It's a very large family of diseases, ranges from the common cold to more severe diseases, including SARS and Middle East Respiratory Syndrome. So COVID-19 is the name that's been given to the disease of this novel coronavirus, the new, the most recently discovered one. Symptoms, fever, chills, a new cough or worsening cough, shortness of breath, muscle aches, headaches, sore throat, and it can be from mild to severe, as we've seen. Some people may not even recognize that they have the illness, and some people are in very, very serious condition when they do become infected. Transmission, this is the one that we've been hearing so much about. Community transmission is the way that the illness is spread most frequently, and it's by infected droplets that come from someone who has the virus in their system, whether they have symptoms or not. So coughing, sneezing, having those droplets land on surfaces where someone else may touch them, being in close contact to someone. So that's where the 6-foot physical distancing, frequent hand washing, frequently cleaning those surfaces where the droplets may land, taking all of those measures, that's why they're so critically important, because this is the major cause of transmission, is by those infected droplets. Could we go to the next slide, please?
Yes.
Risk factors. So this is something where we're starting to get into the specifics of what workplaces are doing and what they are challenged with when they're reopening. So there may be challenges in maintaining that 2-meter distance in many workplaces. As more workplaces open up, more people are coming into them, so customers and clients. So that changes the risk factor. Potential to work in enclosed areas is definitely a reality for many people. Potential for sustained group interaction. So this may be something in schools, for instance, these where you've got groups of people, even if they're relatively small groups, the exposure risk increases as that length of time increases. Probability of infected persons. So there are some that it's an unknown when someone is coming in whether that person is infected or not. So there are some measures that can be taken there to reduce that risk. And inadequate self-isolation practices. So we saw early on that anyone who was returning to the country was asked to self-isolate, and then not too much longer after that, there was actually a public health order ordering people who were outside the country to self-isolate for 14 days. We've seen possibly people coming back from work camps from the oil patch or from major industrial projects outside of the Kamloops area, potentially being exposed at their workplace, coming back to their home, and perhaps not self-isolating or not respecting the 14-day self-isolation period. So those kind of things are all things that have to be considered. The risk of increased likelihood of transmission is this potential for regular contact with shared surfaces. So we see that in many stores right now, where if someone is using a point of sale PIN pad for paying for their purchase, many places have got very clear protocols around that keypad is wiped down, or those surfaces where someone frequently touches it is wiped down between every single use. So those we know that transmission by surface contact is a very difficult one to maintain, but it's also a very critical one to look at. Next slide, please. One of the things that has become very, very clear with the pandemic is that anyone experiencing symptoms associated with COVID-19 needs to immediately inform their employer or their supervisor. They need to physically distance from colleagues and leave the workplace. And depending on their symptoms, call 911 if they're having very serious symptoms. Use the COVID-19 self-support and self-assessment tool, or call 811 to get advice and consult with a healthcare provider, whether that's their family doctor or a virtual online medical service before returning to work. And so the guidance that's being given right now on this is that you have to be symptom-free for 10 days before returning to work. This is a big challenge. We recognize that for many workplaces. A lot of places have had a less formal process in place for a long time about you should not come to work when you're sick. With the pandemic, this has been moved to a completely new level. So it's part of a return to work or return to operations safety plan is having very clear direction to anyone who has symptoms to not attend work. And on to the next slide, please. So we're going to get into the specifics of developing your workplace's COVID-19 safety plan. Just to preface this, there's been a lot of information in the media, on social media and in mainstream media about having a safety plan before you're allowed to restart your business. The way we're approaching that is we want to make sure that people have the basics of their safety plan. It can be a work in progress. So you can't or you should not be reopening a business without having something in place. The very basic stuff, how many people are going to be allowed into that workplace, basic hand hygiene and sanitation steps, those sorts of things, the stay at home or the self-isolation for employees who are sick or who have symptoms. But that safety plan is something that we're not looking for a gold-plated safety plan. It's we want to make sure that people have the basic steps in place, and if there are things that need to be adapted and resolved and evolved as you go through this, that's fine. That's not going to be a problem. You're not going to be taken to task because you haven't answered every single question on the WorkSafeBC template. As long as you've got those basic measures in place, sufficient to ensure that you've taken care of the health and safety of workers and others in that workplace before you reopen, that's great. We recognize that. So on to the next slide, please. So as an employer, under the Workers' Compensation Act, every employer is required to ensure the health and safety of workers and others in their workplace. This is where WorkSafe starts to cross over with the Public Health Office. A couple of things to keep in mind. WorkSafe is not going to review or approve plans, and there is no requirement for a safety plan to be submitted to WorkSafeBC. What may happen is that when an officer inspects, they may ask about that plan. They may look to see if it's complete. We will be asking about steps that employers have taken. Our next moves as we move forward, we'll get into that a little bit in future slides here, but basically we're starting out with a consultative and educational approach. And by order of the provincial health officer, that plan must be posted in your worksite. So that's an order that Dr. Bonnie Henry has issued for any businesses that are restarting under phase 2. Next slide, please. So orders, notice, and guidance. these are orders and guidance from the provincial health officer and the BC CDC, Center for Disease Control. And so these things are still standing orders and standing guidance. None of this has been removed with the lifting of restrictions on specific workplaces. Physical distancing is still an expectation, that 2 meter 6 foot physical distancing. Cleaning and disinfecting of frequently touched surfaces, so the countertops, door handles, light switches, those sorts of things. And for everyone, the personal hygiene, covering coughs, washing your hands frequently, avoiding touching face and not sharing food, drinks, or items. So there was a comment just before the meeting started about some restaurants. Menus are a challenge for restaurants, so some places are choosing to go with a single-use disposable, just a printed sheet of their daily menu that is disposed of after it's used. We heard that there's places that are using an app where people can pull up the menu on their smartphone so that there's not that cross-contamination happening. We're going to see a lot more of those sorts of things, and people are getting very, very good at recognizing how to manage that cross-contamination. On to the next slide, please. So the COVID-19 safety plan, this is the plan that the Public Health Office has provided an order that it must be posted in the workplace. And WorkSafe has created a template. This is not, you're not obligated to follow that template by any means. These steps do align with what the Provincial Health Office has defined as the elements of a plan. So that template is available for use on WorkSafeBC.com. So the steps to creating that plan is assessing what the risk is in your workplace. And that's something that every individual workplace has to do on their own, because you cannot apply a one-size-fits-all approach to this situation. Every workplace is configured differently. The work is done differently. So a barbershop is not a barbershop as on and down the line. Everyone is set up differently. Same with restaurants and retail. Everyone has unique situations, so that assessing that risk is the important first step. Once you've identified those risks, implement measures to reduce the risk. And we'll talk in a little more detail about that one. Developing policies to manage your workplace. So that's policies for not only the people who work there, but also for customers and clients who come in. Developing communication plans and training. So whatever policies are developed, they're not going to be much good unless everyone who's impacted by them understands clearly what the expectations are. Monitoring that workplace, updating the plans as needed. So is that control that you've identified, is it working properly? And do you need to tweak it a bit, or do you need to just take a step back and find a different way of doing that? And one that, because many workplaces have been closed for several weeks now, assess and address the risks from resuming operations. So that could be as simple as workers who are returning to that workplace, going through a reorientation. Here's some new policies, here's a new procedure that we're using. But it could also be that because of the amount of time that that business has been closed, it may require that employer to hire new staff or to supplement their staff with new workers. So assessing those risks, making sure that everyone understands not only the risks of COVID-19 exposure, but all of those other risks that might exist in that workplace. So next slide, please. I'm going to go through these steps fairly quickly because everyone will have access to this this PowerPoint and, of course, the The risk assessment template is available on WorkSafe.com as well. And I'm not going to just continue to read off these slides. Everyone can certainly do that on their own when they have time to do that. But just to very quickly go through the steps: assessing the risk, where the risk of transmission is introduced, involving frontline workers, supervisors, joint safety committee if your business has one, worker representatives. On to the next one, please. Involving your workers. This is really important because that's like with everything else in a business, the workers can have a huge impact on how successful your program is. So workers really need to not only understand, but they need to be an active part of monitoring and identifying what controls should be in place. And on to the next, please. So once you've identified those risks, implement protocols. So put protocols in place to minimize the risk, with an emphasis on physical distancing, other measures where physical distance cannot be maintained. So this may include things like personal protective equipment, non-medical masks, surgical masks, cleaning and hygiene. I don't think we've ever, as a society, heard as frequently how important it is to wash your hands. It's become just a mantra for everyone. Go to the next slide, please. So when we talk about selecting protocols or selecting controls for any kind of a hazard, we always follow this hierarchy here, and this is something that we use in identifying and controlling risks in many different areas. So the top one, elimination of the hazard, is really that is the best and the most effective control available. So in the case of COVID, policies and procedures to limit the number of people in the workplace, ensure physical distancing. That is a form of elimination. By reducing the number of people, you're reducing the level of exposure. Next step down is engineering controls, where that risk cannot be eliminated. So you go to a control that does not require someone to directly interact with the control every time. So things like plexiglass barriers at point of sale spots, that sort of thing. Administrative controls gets a little further down on the effectiveness level, because these are things like rules and guidelines. These are things that rely on that worker or the people in that workplace and the customers in that workplace respecting those kind of controls. So if, for instance, physical distancing can't be maintained and the control is that we're only going to accept people into the workplace who confirm that they do not have any symptoms, you're relying on that person to be honest about that control. In most cases, I'm sure that people are being honest about that, but the effectiveness or the reliability of that control is a little bit further down the list. And then the fourth level of protection is personal protective equipment. So again, that relies on so many factors. It relies on the person who's using that personal protective equipment, using it correctly, maintaining it correctly. If it's a respirator, for instance, that that person is fit tested for it and it's the appropriate respirator. So we always start, when we're talking about managing risk, we always want to start with that, the highest level that is practicable or reasonable for that workplace. Next slide, please. Workers in vehicles. This is a reality for many workplaces. So now that vehicles can become a workplace, can be considered a workplace. So limiting essential travel, banning non-essential travel. If there's a need for more than one worker to be in that vehicle, how can that vehicle be, the physical distancing be maintained in that vehicle? If it's a smart car versus a minivan, the challenges obviously are much different on maintaining physical distancing. So those sorts of things do have to be considered and managed. And on to the next slide, please. Cleaning and hygiene, this is part of your controls. So enhanced cleaning protocols is what many workplaces are referring to. So we see in some stores where there are dedicated people going around and doing nothing but wiping down all of the surfaces, the door handles, the handles of the food coolers, the surfaces, the rails around the food coolers, those sorts of things. So that, depending on the workplace, that may be something that is necessary to add to the way you previously did business. If the previous cleaning protocol was that there was a cleaning person who came in on a regular basis.
Could you try again?
Then sorry, my Siri is trying to interrupt me here. It's listening to me. Okay. So anyway, cleaning and hygiene protocols, depending on the type of work, the number of people that are going through that workplace, those are all important. On to the next one, please. So developing policies. So you see these all, they flow from as you identify the risk and identify controls, then you develop policies to support those controls. And so that might include who can be at the workplace. Can some of the work be done without having that person physically at the workplace? In some cases, that's a reality. In many cases, it's not. How to address illnesses that arise at the workplace. So if you have someone who is experiencing symptoms of illness that are consistent with COVID-19, how do you manage that? What's the expectation for them? And by changing the way people do their work, you need to assess whether that's introducing a new risk. Can the workers be kept safe in these adjusted working conditions? I'll give an example of a company that was still operating through phase one. They had a situation where they needed to have more than one worker in a work vehicle, and one of their proposals was to put a transparent barrier down the middle of that vehicle. Unfortunately, that barrier, if that person needed to get out the other side of that vehicle, that barrier was now in their way. So if that vehicle was in an accident and the driver's door could not be opened, the driver would be effectively trapped in the vehicle. So those kind of things, anytime you introduce a new control, got to also assess, is this going to introduce a new hazard to this workplace? On to the next one, please. Communication plans and training, making sure that everyone who enters the workplace, including workers from other employers, so if you have service people, for instance, suppliers, sales reps who come into your workplace, they need to know how to keep themselves safe at that workplace. What are your protocols? What are your expectations for someone coming in there? Train everyone on the measures, post signage, and this includes direction for customers, for members of the public. Ensure that supervisors have been trained on monitoring workers and the workplace to make sure that those policies and procedures are being followed. Next slide, please. Again, monitoring, update those policies and procedures if you identify that that particular procedure or control isn't working effectively. Very important one here. Make sure that workers can bring those safety concerns forward. It's very important to have a safe way for workers to report that and really encourage workers to bring those things forward. That workers see everything that is happening at that point of contact with the customers. So it's very important to make not only give them a safe way and a clear way of communicating that, but encouraging them to do that and holding them accountable to that as well. Okay, next slide, please. And assessing and addressing risks from resuming operations. So in this case, has there been any staff turnover? Are workers being required to change or adapt their job roles to use new equipment? And I'm just going to switch my phone because my headset is starting to die here. So I'm just going to quickly switch this over. Can you still hear me there?
Yep, that's good.
Okay, perfect. Okay, so assessing and addressing those risks from resuming operations. Have you changed anything about the way you operate? Is there different equipment that is going to be used? Are there new processes that might introduce new risks? If you have tools, equipment, machinery in the workplace, if it's been idle for a period of time, is it to have a look and see if it's if it requires any additional maintenance before it restarts? Make sure that systems and lines are cleared. Okay, on to the next one. This is the COVID-19 safety plan template. So just everyone will have a link to this template. It's about 10 or 11 pages long, and basically walks you through that process, those 6 steps of developing a safety plan. And so with that safety plan, you can tailor it to your particular workplace. Some of it, of course, will not be necessarily relevant. That's fine. This is our attempt at making a template that will be usable to everyone, and there will be many workplaces where a lot of these steps that are recommended or suggested just don't apply in that workplace. So again, it's going to be very much an individual plan. Next slide, please. Workers' responsibility, of course, this is an important one. It's not all about the employer taking full ownership of this. Workers have every bit as much of a role to play in this, and so workers need to know when not to come to work. They need to follow those preventive measures while at work, including following the instructions that you've developed, practicing physical distancing, cleaning, disinfecting, personal hygiene, reporting hazards. So, again, having those lines of communication with the workers, reporting hazards, and refusing unsafe work if that is something that they encounter. And as part of their responsibility as workers, taking steps to minimize their exposure while they're away from work. Because if they're following all the rules at work, but then they're not doing it away from work, that's kind of undermining all of the efforts that you've put in to try and keep that workplace safe and healthy. Next slide, please. And just on to the next one from there again. So this is the list of phase 1 and phase 2 industry-specific protocols. These are things that have been developed, and there's actually a few more that have been developed and posted today that are not included in this list. So phase 1, these were the workplaces that were designated essential services: agriculture, construction, forestry, on and on. Phase 2, these are the businesses that are now being allowed to reopen with controls. So health professionals, this is all of the supplementary services, dentists, optometrists, massage therapists, chiropractors. In-person counseling is part of phase 2. People who work in offices, parks, personal services, so that includes spas and hair salons and estheticians. Real estate, restaurants, cafes, and pubs. This is going to be probably the biggest sector that starts to reopen, and retail for the places that chose to close down during phase 1. Next slide, please. So we're going to go through some of the support and services that are available. So if you go to the next slide, please. Accessing the services that are available, so WorkSafeBC.com. When you go onto that site, the banner across the top is all things COVID. So all of the links to the safety plan template, the industry-specific controls and recommendations are all there. So that is your one-stop shopping center for everything when you're planning your reopening or moving forward with developing and enhancing your plans. Next slide, please. So prevention efforts. Our plan in prevention is in the early stages of phase 2 reopening from today onward. Officers are going to be reaching out to workplaces that are in that phase 2 category, asking questions about, do you have a plan? Do you include these things in your plan? All those questions. So you may end up getting a call from a prevention officer asking those questions. What we're asking, wherever possible, we would like to have a worker representative involved on that call so that workers are committed and recognize that they're an important part of this whole process. You can also, if you have specific questions that are not answered by accessing the website, you can call the prevention helpline. So it's the numbers are on the screen there, 604-276-3100 or 1-888-621-SAFE, 617233. That'll put you in touch with a prevention information assistant who will then relay that call to a prevention officer. We've got about 24 officers today working the phone lines around the province, taking those calls. Call volumes are higher than we've ever experienced in the past, but our goal is to try to get back to people within no more than 2 hours, and in most cases it's less than that. So if there are specific questions, that's an option that's available to you, and you can get in touch with a real person. It's not going to be one of these press 1 for no and 2 for yes type of automated systems. The next slide, please. I'm just going to very, very quickly touch on this one. We don't deal with claims in the department that I work in, but if there are claims is an integral part of the business that we're in, and it's for many employers, especially small employers, it's probably one of the only contacts that you regularly have with WorkSafeBC. If someone is injured through their work, that's the claims department is the people you're going to be dealing with. So for existing claims, payments continue and have continued throughout the pandemic. Some of the things like submitting expenses and managing claims, we've moved to a more of an online process. One of the things that was recognized early on is that there are many, many people still who are on a claim who do not have direct deposit. So that was a big challenge because of course our mailing department, they've got their own challenges with trying to maintain operations throughout the pandemic and with physical distancing. So a lot of changes on our side of things. For workers that do file a claim, making sure that their employer is notified of that claim. Nothing more frustrating for an employer than getting a letter from WorkSafe saying we need a report from you about this claim that's been filed, and nobody has told the employer up to that point that they were even seeking medical help or filing a claim. Most of the process is going to continue as it has. It should be fairly seamless for everyone on the employer side of the portal. If you do not currently use the claims portal, it's probably a good one to look at if you do have a new claim that comes your way. Next slide, please. So the links to the public health agency websites are going to be listed in the presentation package that you receive. So the BC Centre for Disease Control, Provincial Health Officer, HealthLink BC, and the COVID-19 self-assessment tool. So this is where anyone who has any symptoms of respiratory illness can go and do a self-assessment, and it will provide some direction on should you seek medical aid or should you monitor your symptoms, or based on what you report, you appear not to be at risk of COVID-19. Of course, Interior Health in our region is another one that Interior Health has issued some public health orders outside of the provincial public health office as well. And so they're a good resource to look at as well. Next slide, please. Some more resources, and these, of course, will all be included as well. There's a business continuity planning checklist that the provincial government has published. There's Small Business BC. They operate a BC Business COVID-19 support service. They're single point of contact for any business throughout the province looking for information on resources. So there's a lot of overlap in this. There's lots of resources out there. Just use whatever is appropriate for your particular business. And the Canadian Centre for Occupational Health and Safety has published a lot of really good information as well. They're a good source for health and safety information in general. And next slide, please. So that is pretty much it for this presentation. I know I went through that fairly quickly, but even at that, I still ended up going a little bit over the allotted time. So just open it up for questions if anyone has any.
Okay. Just looking in the chat here to see if there's anything. We had a couple people that had to leave.
Hi, Vince. I work with Deanna at the Chamber. My name is Acacia. We've heard, from quite a few different business owners in the community about some anxiety around having, WorkSafe investigators, popping by and checking in. Can you let us know a bit about the verification process? Are people going to be fined right away, or is it only in non-compliance? Is there a timeline when people have something reported that they have to fix it by? I think there's a lot of questions around those guidelines that we have. So if you could speak to that a bit, please.
Sure. So our approach right now, and for the at least for the next couple of weeks, is going to be wherever possible. It's going to be consultative and educational. We're expecting that people are going to have challenges. We recognize that. It's not the time to be taking a heavy-handed enforcement approach by any means. So the first week or two is it's going to be rare that an officer is coming into a workplace unless there is a specific high-risk reason to do that. So, you know, if we're advised of something that is putting people at high risk, then officer is going to be assigned to investigate that and attend that workplace in all likelihood. For the majority of workplaces that are reopening under phase 2, it's going to be, we're going to try to select as many as possible, keeping in mind that there are 240,000 workplaces in the province, and there are about 300 prevention officers. So we're certainly not going to get to every workplace. You know, we would be lucky to reach a significant percentage of those. So the approach is going to be contact by phone. We're going to try to maintain that approach at least for the next couple of weeks as we start to figure out our own protocols for getting back into the workplace. So if I guess for anyone who's anxious that you know, an officer is going to be coming in looking for violations, unless there is something that is identified as a high-risk situation, that's not going to be the case. We're going to be reaching out, making sure that people are aware of what their responsibilities are, but also providing that support and consultation to them.
On a similar subject to that, with a lot of people looking at engineering controls, and a lot of businesses, of course, have made a pivot to manufacture those things, is there guidance on, you know, what those things should be, size requirements, openings, things like that? And would those potentially come down if they don't already exist?
There's no specific guidance on that because it's really it's so varied. You know, if it's a plexiglass barrier at a point of sale position, it has to be sized and designed to fit that space. So keeping in mind, you know, what is the intent of that barrier? So if it's a sufficient size and type of material that you know, prevents that droplet spread. So if someone coughs or sneezes, is there a sufficient size of that barrier to prevent that from contacting the person on the other side of it? That's really what you should be looking at.
Vince, it's Acacia here for the Chamber. We've heard from a lot of our not-for-profits, small business owners, charities around not being able to access PPE at the quantity that they need, nor at a price they can afford. Is WorkSafe doing anything right now to try to help that supply chain out for our small organizations? Or will there be any resources coming down the road that our smaller organizations can expect to see?
I know that question has been raised many times. I don't have any current information on that, but it's certainly something that I can make some inquiries about and get back to you, and that you can share with your membership.
That would be great. I think in the last week that question has really come up around how to access and where to access to ensure everyone is safe. So anything that you can provide to us would be very helpful. And then I just want to ask a bit about the consultation from industry. So we've noticed that WorkSafe is working with lots of industry associations, and I'm wondering, is there a way for smaller businesses that are putting in these protocols, if they're coming up with some solutions, can they bring that information forward to WorkSafe to try and make it as an industry standard? Or what, if you just could speak to the consultation process from industry, I think that would be great.
Sure. So one of our departments is Industry Labor Services, and they're the department that is, they coordinate all of the various industry associations. So organizations like Go2HR and WorkSafeBC and the Manufacturing Safety Alliance and the Construction Safety Alliance, all of those organizations that represent industries, our Industry Labor Services folks work with them. They are going to be taking, Industry Services, that is going to be taking an active role in this process as well. So they are working with those associations and making sure that as best practices or innovative controls are identified, that they're sharing that with not only with all their members, but with anyone who happens to be in that sector. So for most small hospitality businesses, Go2HR is the industry association that would represent them. Regardless of what your business is, there's probably an industry association that at least has some involvement with the sector that you work in. So those are all good ones to check out. The industry associations tend to be a lot more agile than WorkSafe is able to be when it comes to publishing new information. So if you are part of that industry association, or if you even check their websites, check them fairly frequently, because they are very, very quick at getting best practices up and providing additional resources.
And I just want to speak a bit to, you talked about 24,000 businesses, or I think that's what you had said, and only about 240,000, and then with 300 prevention officers. So has WorkSafe increased capacity at all to manage the probably the water hose of businesses that are going to be trying to access support?
Pretty much every prevention officer, the expectation is that unless they're called to a serious incident, or they have to attend a work refusal or something like that, that they are going to be focusing all of their efforts on this outreach activity for the next couple of weeks until we start to transition into more on-site inspections. I can see that, likely over, the next several months, probably, this is going to be a very high-level part of what we do. We're really starting to, for the time being at least, doing business much differently, making sure that we have those information officers available as much as possible. Over this long weekend, for instance, we ran the information lines all 3 days over the long weekend, so that the businesses that were trying to get that information and needed it immediately had an opportunity to get it. So in terms of hiring additional prevention officers, that's not something that's likely to happen in the short term. There's quite a process to that. There's a fair bit of training that goes into that. So I don't anticipate that there's going to be a shift in the jobs that people do within WorkSafe. It is a somewhat specialized activity that prevention officers do.
Are there any other questions from participants on the call today? I really tried to kind of capture the high-level questions that we've been hearing from our members. So hopefully I kind of found some different spots for people on the line today. I'm not seeing anything else. Vince, is there anything else that you'd like to add?
No, not really. Like I say, keep these information lines, these numbers, and I see that there's a typo there. This was it should be 1888, not 1 4/8 on the WorkSafe Prevention Information Line. But that is a good resource for anything related to any health and safety issue, whether it's COVID-19 or any other health and safety matter in the workplace. You will get a call within a fairly short time from a prevention officer or a subject matter expert who can answer that question. So please use that service.
Perfect. Well, I think that is it for us. I know our team is going to send out the presentation from Vince and WorkSafe to everyone who's attended. We also have the KCBIA on the line, and we have Carl and Christine on the phone, and they'll have another representative from WorkSafe on Thursday. And so if there is anyone that you know that would want to attend or have additional questions from today, I'd recommend you follow that up. But yeah, Vince, I just really like to thank you for taking the time to speak with our members today. We've been receiving lots of questions about WorkSafe and how to get people to open safely. So really appreciate you taking the time.
Okay, thank you very much for the opportunity.
Thanks everybody. Have a great day.
That's been great. Thank you, everyone.